I can tell you in 2021, our country was facing one of the most significant and destructive crises in the world, which is we were seeing overdose deaths from drugs go up by up to 31% per year. I knew that we had to be nothing short of a miracle. And I will tell you as a result, in the most recent numbers, we are down 17% for overdose deaths overall and 22% down for fentanyl. That's a 53% turnaround in a matter of 3 to 4 years. I mean, we have today more people sitting at dinner tables, in chairs in schools, children, young people, as well as middle-aged working. It's all because they're alive. When your population is dying at over 100,000 people per year, majority of them working age between 25 and 49 years of age, you've got a public health crisis, but you also have a national security crisis, as well as an economic opportunity crisis. So it was important to work with law enforcement agencies, intelligence agencies, to have them know that they're a very important part of the solution. They're out there fighting for us, and that's why they're keeping communities safe. They're seizing more drugs at the border. They're stopping bad guys across the streets across this country. In some states, number of people overdose and overdose and overdose the same person until they finally died. We wanted to expand this naloxone, which is the antidote. We wanted to make it more affordable, more accessible. Law enforcement in this country has gotten tired of locking people up because of addiction. And they wanted to see a new way where we could help people because some of their own family and community was being impacted. There's no red state, there's no blue state. It's America's problem. So that's why it became part of President's unity agenda, but also, more importantly, it became part of the conversation in small towns and large, every business, every faith community, and across law enforcement and public health. It was so easy for me as a doctor to write a prescription for opioids. When the same patients come back to me and say, "Doc, I think I got an addiction to opioids. I need help." Well, you needed an extra license to treat them. It was ridiculous. And it was just not fair for them because oftentimes I would be forced to send them to an expert. As a result, they'd have to take time off. They'd have to find childcare. They'd have to find gas money. And you know what happened more often than not? They just didn't do it. And then I ended up seeing them in my arms in the emergency room dying because they just couldn't get to a doctor on time to treat their addiction from opioids. As a result, today we've gotten rid of those extra licenses. We have 15 times more providers, doctors and nurse practitioners and PAs across this country now who can provide treatment. We know that addiction is a disease of the brain. It tends to hold hostage your brain for so many other aspects of your life. And that can have impacts on not only your personal life and health, but your family, your connections, your community, your employment. Today, there's 3 types of countries. Those that got a synthetic drug problem and know about it, like United States. Those that have a problem but don't know yet about the problem. And those that are going to have a problem. And the role of private sector is so important because of that. Not only acknowledge and understand and appreciate that, but it's really important for government to be working hand in hand with the efforts of the private sector to make sure that the bad guys are not getting an edge. And we need to move with the speed of business. It used to be where we bring people to our offices, but today we're going to the people on their sort of terms and getting them the help. And that's exactly the right policies. The fact is today that 90% or so of fentanyl is being carried through the legal ports of entry, and it is often carried by commercial vehicles, personal vehicles, and oftentimes individuals on foot traffic can often be American citizens. So I looked at the data to see how much of technology do we have to scan vehicles. Only 5% of the traffic is being scanned. So we put a goal out to have 100% scanning of those vehicles that need it. All the drugs I mentioned, all the fentanyl that we stopped more in 2 years than the previous 5, is the fentanyl that is not going into communities and it's not killing Americans. And that's one of the major reasons that you're seeing such a drop in overdose deaths across our country for the first time in the history of the United States.